So the first thing that I'm gonna present and talk about is the resonant voice technique, which can be used for hypo or hyperfunctional disorders. And the goal is to decrease medial compression and increase loudness and ability to project your voice without overusing it. It consists of more of the frontal tone placement, and it starts with syllables, and then you work your way up with words and then sentences to generalize to conversational, spontaneous speech. Flow phonation is used to increase airflow and decrease medial compression of the vocal folds, and it's focused on connecting speech with the frontal tone. You want to use more of your stuff that's up here. So the first part that I'm going to do is for flow phonation is going to be the tissue paper technique, which is just really trying to show your patients how you want your voice to be very flowy, more like a melodic sounding, and not hard speech where they're more tense. So you just want them to take the tissue paper and just start, blowing. So they kind of get the idea just of, getting the air out, and then you can go from blowing to voice sounds. So you can go. And then from then you can go from the S to Z, so from voiceless to voice, Z, and from F to V, so you can go V. You just want their voice to be flowy, like on water, just easy go, and to sound good and nice and easy to listen to. And then from the F to the V, and then you can move from fricatives like C and so. And a lot of times with flow phonation, they work with M and N and J, mom and mean and man and moan. So it's kind of like an om calming yoga sound. So that's for flow phonation. And the next part is going to be for circumlaryngeal massage. And this is especially good for people who are very tense up in here and their larynx is kind of raised. So this is just a digital manipulation with your hand, and you kind of work your larynx around. And it's just interesting how easily the larynx can be manipulated. So you can even tell in your pitch if you just by lowering your larynx, you can hear the different pitch sound. So first with the circumlaryngeal, you want to locate the hyoid bone. So you go here, and then you'll run right into it. And then you just start massaging. You can go from the lower horns and work your way back to the superior horns and the way back. And then you want to work your way down and locate to the thyroid cartilage, the superior cornu. You just kind of want to massage in there. Just slow circles, don't press too hard. And you have to remember to breathe through this whole process because you are touching your neck, and that can make someone feel pretty uncomfortable. And then you locate the thyrohyoid space, which is easier to do on men, of course, because they have the Adam's apple. But you can feel the notch, and you can feel it. So you just kind of want to circle up in there. And then you want to move yourself up to the suprahyoid area. So, of course, supra is above the hyoid area. You can do the floor of the mouth, too. Just slight massages. Loosen yourself up for your patient. And then you also want to do the sternocleidomastoid, which connects from the mastoid process right by your ear. You want to pinch. I mean, it's the one that you see right when someone turns. It's the main muscle that you see that needs to be stretched because that can get really tense. So you can work your way down. And it's another one that you stretch when you do your shoulder and neck stretches. You want to make sure that you stretch that out. So you can kind of just pinch it. Work yourself up and down. just to kind of loosen up. And hopefully after all this, you can feel the tension decrease and the larynx will hopefully have relaxed and lowered. But that's it for circumlocution, or circumlaryngeal massage.